Okay. So, welcome to Is My Community Ready? Where you're going to learn about what Oregon found out when they conducted their problem gambling community readiness assessment. It's our hope that this will help spur ideas as you complete and analyze your assessments. It's my pleasure to introduce Roxanne Jones, who is currently the problem gambling statewide prevention outreach specialist with the Oregon Health Authority. She brings over 30 years in designing and implementing prevention programs to address risky behaviors and in conducting program management in problem gambling prevention, treatment, and children's mental health services. If you have any questions during the presentation, please enter them in the chat area, and I'll try to monitor that and let Roxanne know that they're there along the way. And Roxanne will address these at various times during the presentation. So without further ado, Roxanne, take it away.
Great. So thank you so much, Anne. And thank you all for joining us today on this presentation on, is my community ready to address problem gambling prevention? I'm excited to share with you Oregon's experience utilizing the community readiness model for problem gambling prevention as part of our outcome-driven system. And like Anne said, I've asked her to keep an eye on the chat, and so please feel free to pop things in there. And if you have any questions, she'll let me know, and I'll try to address that along the way, and keep us moving so we can get you on with your day. You guys are in your afternoon. I'm still in my morning. So also want to just put out there that I do work from home, and I share my home office with two four-legged lovable but sometimes barky creatures. So I apologize if they decide to add their piece to the program today, but hopefully they'll keep it to a minimum. So, my goal for you all today is to walk away with a clear understanding of why here in Oregon we selected the community readiness model, and an understanding of the dimensions and the stages of the community readiness assessment, and how we utilize it statewide in Oregon to develop our outcome measurements for each of our counties or regions. Some of our counties combined into regional areas for a variety of different reasons. And I'll also share with you some examples of some strategies that align with the stages of readiness that we found as part of our implementation plans that we use here in Oregon. Just to kind of give you a brief look of what Oregon looks like and some information about our problem gambling services system. I was kind of sharing with Anne earlier that if you live up here in Wallowa County, it's a long ways over here to the Oregon coast, and so it can be quite a drive. And the same with all of actually our friends in these counties over here. But we're a pretty big state when it comes to that. So you could spend about 10 hours driving to get to the other side. But our problem gambling services system is always evolving. We have a 5-year system improvement plan that will actually be updating come this fall because it's time. And prevention is a key component of our system, along with treatment and recovery. But Oregon, like I mentioned a little bit ago, is very diverse geographically. We are marked by volcanoes. We have abundant bodies of water from lakes and rivers to the Pacific Ocean along our western coastline. We also have dense evergreen and fixed forests, and then we add into the mix some high deserts as well. So we've got a lot of geography going on, which also has a lot of impact on our prevention work and how we engage in the metropolitan areas, urban and rural communities. I was looking at Virginia. You also have a lot of diverse geography as well. And there may be some similarities. I'm not as familiar because I haven't had opportunity to visit your great state, but hope to one day. So before we dive into this community readiness model, I want to just take a moment to read. And it's one of my favorite quotes from Margaret Mead. And it's not new. I think you've all seen it, but I always think it's really speaks to the work that we're doing in prevention, especially around the community readiness model. And so that's: never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And so my goal today is to lay a foundation on how bringing your small group of thoughtful, committed prevention champions together is key to increasing problem gambling awareness and maximizing your prevention efforts in Virginia. So why focus on community readiness? Well, our reason why is that community ownership of whatever issue or whatever problem we're trying to address helps ensure that the strategies are culturally compatible and sustainable, working together as a community to increase awareness or address an issue that might be impacting the community really is key to your success. So involving your community from the beginning in your planning process, your readiness assessment will help bring them along and develop key champions also to help you with your programming in your area. So Oregon's decision to utilize the community readiness model was multi-layered. The model itself promotes community recognition and ownership of the issue. And again, for us, the issue was the prevention of problem gambling. That also by matching effective strategies. I mean, they have done some research and have developed effective strategies based upon the community readiness level, the stage that your community is at in the individual dimension within the assessment. And also integrating culture into prevention in the process and creating a community vision for healthy and safe communities is foundational to our work. And so it really seemed to meet where we were headed with our prevention program here for problem gambling. And so this is the model that really spoke to us and had been utilized here in Oregon for a couple other projects as well. And so we were familiar with it, but wanted to see how it would work with problem gambling prevention. So again, why this tool? It was important when we were considering this, what tool we were going to use, the research on the tool. So the research that was out there on the community readiness model has found that the tool has high face validity, meaning that the tool appears to measure what it claims to, and that the construct validity was found to measure a representative sample and high consistency among the respondents. And then, the inter-rater reliability, I always have trouble with that one, score was 92%. That showed 92% level of agreement between the raters that were using the document, the tool. So, I mean, it had some good research behind it that showed that it was a valid tool that could provide us a lot of information that we would like to have for our program. And also the anecdotal evidence, there's so much value in that. What can be gathered from the personal interviews within the community really helps build a stronger understanding of where the community is in relationship to what we were working on, problem gambling prevention. The new connections that were developed and the opportunities to raise awareness during the process was also a win for our system, because we found ourselves having conversations with people we might not have had conversations with in the past. So for us, it was a great tool to utilize. And then when we selected this model, it comes out of Colorado State University. We met with one of the developers of the tool, along with a consultant here in Oregon that had utilized the tool, and it had not been used in the past for problem gambling prevention. And however, in talking with the developer of the tool, she felt like this was a very good fit. And so we were one of the first that we're aware of. I mean, it certainly could have happened and not consulted with the developer, but we're one of the first that we're aware of that has utilized the tool for problem gambling. And so the model itself utilizes a scripted interview process where a minimum of 8 key community members are interviewed. It was interesting. There was another program that had used the tool and felt like their community was on an alcohol readiness assessment for prevention felt like that the 8 interviews was not going to speak to their community. So they actually conducted 250 interviews within their community. And they found, even by breaking up the interviews into eight segments, that it didn't change their results. Although for some communities, interviewing more than 8 was something that spoke to the community, and certainly even happened for our project, was to conduct more than 8. The interviews are then transcribed verbatim, which is important. You really want to capture what the individual states, not what we're reading into the situation or what we think they might have said. And then the interviews are then transcribed, again, verbatim, put through a consensus scoring process, utilizing an anchored rating system that ultimately will provide a score related to the individual dimension stage of readiness. Easy peasy, right? No big deal. So actually, it definitely is a process, and something that it took some time, and but was definitely a great value to our system. So I understand that some of you, about I was speaking with Anne earlier, about a third have already completed your community readiness assessment. Others are in the process. Some are also still working toward getting started. And so for some of you, this might be a quick review. Others might be new material, but here we have the 6 dimensions of community readiness on this slide. So, it ranging from community efforts, community knowledge of the efforts, leadership, community climate, community knowledge about the issue, and then the resources related to the issue. And so those are the 6 dimensions. Here in Oregon, we evaluated our community readiness to prevent problem gambling. That was our focus area. And it was important that we added in that prevention component, that we weren't specifically speaking to the treatment component. We did find that individuals often were aware of treatment services due to a lot of our successful partnership with the Oregon Lottery and advertising of Oregon's problem gambling resources in our helpline. However, the reason or the awareness to why we had treatment services and how to prevent problem gambling was low.
Hey, Roxanne?
Yes.
There's a question. Do you want me to go ahead and read it?
Sure.
Okay, Melissa Ackley asked, did you consider focus groups versus individual interviews? And if so, what factors led you to choose individual interviews?
No, that's a great question. And it did actually come up, and we worked with our consultant around that. And we did move really toward the individual interview process, because in focus groups, often the responses, one, you might have one voice that is stronger than others. And so it doesn't give everybody, even though you give everyone the opportunity to speak, often some may feel not as comfortable speaking. And so it really provided us, by having the individual interview, the opportunity to get that person's perspective and their awareness versus kind of a group think. It wasn't that, we certainly, had talked about the allowing it if it was the only way to get the information, but we were definitely concerned that you wouldn't get the response to the individual questions, and that, some voices would carry over the top of others, or often someone might start sharing information that then may lead into the next question. So then the group may already kind of, maybe, I don't want to say know the answer, but they might know the answer. So we did go with individual over a focus group. But that's a great question. Thank you. And again, just for a lot of you have probably already seen the tool and are aware, but I want to just kind of do a quick review. Here are the stages of community readiness. So the previous slide were the dimensions. Now these are the stages, and they range from, and they kind of work their way up from no awareness, denial and resistance, vague awareness, pre-planning, preparation, initiation, stabilization, expansion, confirmation, and community ownership. And so those are the stages. And I know it's kind of probably a little harder to see on, well, it's a little bigger on the main slide. So what I did here was I just included the definitions of the stages here for your reference. So Anne will be providing you guys a copy of a PDF of the slide deck so that you'll have that. And here are the definitions, how they come from our manual, where we did insert problem gambling into the stages. So I'm going to share that with you all. And again, it'd just be something for you to refer back to, because it's a lot of information on one slide, and I do apologize for that, but I didn't want to break it up. So by the time we wrap up our time here together today, you'll have heard the words community readiness multiple times. You might be a little tired of it by the end of today, but anyway, I think it's really important to remember that communities and organizations and networks, whether that be your social network or other networks that you're involved in, they're always ready for something. So it's not an issue of ready or not ready, but an issue of ready for what. And so the assessment hopefully will help guide you toward the what, so that you know what your community is ready for, and then you can match or align your strategies to ensure that you're working toward the awareness level or the education that you're hoping to obtain in your community. So we had our purpose and our benefit behind why we opted to go this direction. Oregon problem gambling prevention providers, they develop implementation plans to guide their work. But often, the question would come up when they were looking at their outcome measurements. It was a real struggle. How do we measure increased awareness? We needed to have baseline data to do that, to measure where the community's awareness level was, so that when you were saying that you were increasing awareness, you could actually have a baseline data to allow for that, so that you could see that the strategies that you were utilizing were aligned and were working well with where your community was. So if you develop a strategy, for example, develop a strategy to pass a community-wide policy regarding gambling within your community, and your community's awareness level about the risk associated, or even the impacts of what gambling can have on the individual or families or the community itself is low or maybe non-existent, it could be a real uphill battle to be able to pass a policy, because you have to do all of the building foundations along the way so that your community can understand that the gambling is an activity that carries risk, that there are impacts to not only the individual but the family and the community. And so part of that is really raising the awareness level and having your strategies be appropriate for where your community is at. But one of the biggest benefits for us now is we now have a consistent statewide measurement tool and measurable outcomes for our programs to utilize for their long-term outcomes. What they're hoping for. They'll be able to replicate the community readiness assessment and see what progress they've made in the areas that they're focusing on. So, I mentioned this a little bit earlier, but we did work with a contractor and a consultant with Barbara Plested out of Colorado State University when we developed our community readiness assessment manual for problem gambling prevention. We then trained all of our statewide problem gambling prevention providers in the model, and we did this over a 2-year period. We had 2 cohorts roll out, Our second cohort, unfortunately, was finishing up their process of March of 2020, so was impacted by COVID and had to do a little modifications to how they were doing their process, because our first cohort, all of the interviews were face-to-face. Second cohort, we did make some modifications and do some phone interviews so we could finish up the process because programs we weren't able to be face-to-face at that time. And But basically, during that 2-year period, all of our contracted providers conducted the community readiness assessment. Many were for their counties, but again, some were actually, we have two sets of regions which encompass 3 counties each, and so it was a regional approach. We even did a couple of organizational assessments as well. One program asked if they could assess their organization, and so they did that to see what their organization's readiness level was. And we did that internally also within the Oregon Health Authority to see where our program was, or not just our program, but where our state agency was as far as their readiness level, and to increase readiness and awareness around problem gambling within the Oregon Health Authority itself. The program staff conducted the key respondent interviews, or in some instances, they also contracted out that work because they already had full-time work going on. And so they did utilize some additional funds that we provided them to contract out the work. But those, they conducted key respondent interviews across various domains. I'm sure this is familiar to all of you as well with your process, but looking at individuals from the behavioral or physical health domain, youth serving agencies. They had folks interviewed from schools and universities, from city councils. We also had tribal governments interviewed, law enforcement and spiritual community leaders, and then also some members from the community at large. So there was a broad spectrum of folks that were identified within each county or region to interview, and that could look different from each community as well. They were really looking at who were their key stakeholders and conducting their interviews amongst those community members. We also had two different programs focus on, they conducted actually more than one assessment. They conducted their general population one, and then they also did some selective populations. For example, there was an assessment on seniors in their community. And then also 2 separate ones on African American and Black community and Latino community. So they were some communities where they either had a large senior population or also were very diverse, and they wanted to make sure that they conducted interviews specific to those populations. So definitely tried to spread it out and got some great information across the board in all of the different assessments that were done. So this slide is, again, a little bit of review. We talked just briefly a little about the community readiness assessment model, but now, we're ready to move to the next steps, which were results and planning. And so again, it was, identifying the key stakeholders, conducting those minimum of 8 interviews. And I'll be honest, we had a couple places where they could not get to 8, especially in the last cohort. They managed 7. And we realized we weren't quite with fidelity there to the model, but at the same time, it was what was able to do during a time where there was a lot of competing priorities, and we didn't want to hold the programs up. And then the consensus scoring and using the anchored ratings scales. And I would say that probably one of the areas that our providers needed the most support was around the consensus scoring. I was joking a little bit earlier with Anne about how it felt like sometimes they wanted just to collaborate on the scores. It's like, let's just, we don't need a consensus. Let's just, divide it and call it good. So it really was a great opportunity to also provide some additional support around looking at the anchored rating scales and having some, questions around, okay, so why would you have scored this higher? What did you see that maybe I'm not seeing? And the importance of really looking at the whole interview, even though the questions from the assessment are broken up by the different dimensions. Often you'll find that different, you might find an answer that will really reflect back to another dimension further down into the interview. So we stressed very highly about the scoring component to read the entire interview. before scoring and not just try to score the sections. And that really helped with often how some of the scores were come to during the consensus scoring thing event that was occurring. And one of the other things that we did stress during the interview process, the importance of not, and this was a hard one, it was hard for me even when I conducted my interviews, was not to provide education and awareness during the interview. Often the participants are like, they're asking questions and you're like, that, yeah, that, that's a great question. I'm going to note that and we'll come back to that when we're done, because what we didn't want to do was change how their responses would be by providing the education and awareness early on. We didn't want to impact our key stakeholders' responses. Again, that was a tough one, but certainly was an area that we stressed highly. Again, the consensus scoring was as 2 individuals, and it actually was a great opportunity for folks to come together. And whenever possible, we have tried to have the scorers not be the interviewer. However, that's not always practical for some of our programs. I know that I was fortunate that my treatment specialist and our program services manager actually did the consensus scoring for my interviews, which though I felt a little left out of the process, but I seem to interject myself into it on a regular basis. But yeah, the scoring process is a really important part of the overall assessment. And then the fun begins, really. You get your results and you get to start with your planning and implementation stage. So let's talk about planning. Unless I don't know, Anne, are there any questions? I want to make sure
there is so there's a question on what stage, whether or not you should answer it now or later, but what stage of readiness seemed to be the most common across the state that you found, and what strategies were used to work on that very common stage of readiness that they found?
Sure. And actually, we will get to that. So great question. And that's coming up here pretty soon. So I'll hold off on that and share that with you here in just a little bit. We won't go through all of the different dimensions that we found in Oregon, just 3, but it'll give you kind of an idea of where things were landing. And I'll be happy if someone has specific questions about some of our other dimensions. I can always send that out later to Anne, because I do have maps for all of the different dimensions, but I didn't include them today.
There is one more question that just came in. The person saying, I'm having difficulty recruiting representatives from the industry to participate in interviews. Any tips on that?
We didn't specifically interview. We had a couple folks outreach to the industry, and I have to admit that there was some hesitancy about that, because they felt like it was outside of their role when they were trying to talk to a representative that might be within their community. And so I don't have any specific tips there. So we kind of didn't see them as one of our primary domains. But we have a partnership with our Oregon Lottery, where we work very closely with them around prevention and awareness. And so unfortunately, they weren't interviewed at the local levels. So in the county and region program. So I wish I had some great tips for you there. But I think that they might be an organization to come out from a different direction, perhaps, but I wouldn't give up. I think that one of the things that we stressed with everybody that we interviewed was that we were really just trying to determine our baseline and awareness of prevention efforts and the awareness around the issues of gambling in our community, and that there is no right answer, and that often I don't know is is very much an appropriate answer. And so we stress that with folks who were hesitant to be interviewed, because we would bump up with, oh, I'm sorry, you know, I don't really know anything about that. It's like, well, that's an important piece. And that will provide us some great information for our assessment. And what we really like to do afterwards is to meet with you guys and provide you as much information as possible. So I realize I didn't really answer your question, but unfortunately it wasn't an area that we spent a lot of time of focus on. Any other questions, Anne?
No, not right now.
Great. Okay. So now the fun part, right? You've completed your assessment. I consider it the fun part. It's all the fun part, but you know, I enjoy the planning component. And so, you know, you've completed your assessment, you have your results. Now what? Now, well, what we saw as our first step was to share back what you had learned. You know, it's really important that if people have taken their time out of their schedule to be a part of an interview process and shared what their knowledge is, that you share back with them the results, that you give them the opportunity to see the results of what their part of the interview process was. And again, this kind of stepping back to the interview piece, one of the other things, and this may also help with recruitment, is that we stress how basically the interviews were anonymous, that when they were going through the scoring process, there was no identifying who had been interviewed on the interview itself, and those we would not release the names of the individuals interviewed. We would release the domains that we release. You know, we interview people through the behavioral health system or the law enforcement, but not the individual's name, and so that they had that ability to remain anonymous throughout the process, so that if they didn't know, they had the ability to feel comfortable with sharing that. So, but it was really important to come back and share that through whatever mechanism. Some programs developed PowerPoints, others just provided them a one-page document that showed the results and where their community was, so that they could move to that next step around community and having a community planning team. So working with whatever team that was identified within their individual program to develop their plan. And again, bringing that community voice to the table also really helped increase some of the different resources that might be available to the problem gambling prevention programs. So sharing your results with your community planning team and discussing your community strengths. Where are the strengths within your community? What resources do you have to build on? Asking your team, what strengths does our community have to prevent problem gambling? And how can we raise awareness? So having that be a key component of when you're sharing back your results and you're doing your community planning component, to really build upon what strengths are already there in your community. Then brainstorming on what might get in the way of reaching your goals, what you might have to address is really important part of building your plan. You know, the resistance that gambling isn't as important of a topic as some of the other things that might be impacting our community, and looking at ways that you can work with that resistance and still get your messaging out. So the brainstorming, the conditions of your community and the concerns are important. And, you know, I think we found that big in this last cohort, you know, when it came to the planning part, because of the impacts of what COVID was having on our communities and their ability to, you know, meet face to face, changing how we do business. There were a lot of different conditions that our actual first cohort didn't even have to consider, but then was able to learn from the second cohort because of you know, how the landscape had changed and how we could do our prevention work in just 1 year at that time. So it's really important not to just, okay, we've got our results, but it's not to forget that important part of sharing back. And one of the biggest benefits that I found from sharing back our results that we did on our internal assessment was we actually developed some key champions within our organization to help us move some of our projects forward within OHA, one being a workplace policy that covered both our organization, OHA, and then our partner and sister organization, the Department of Human Services. And so it really helped us along the way. And so I can't stress enough the importance of finding those key champions and then nurturing them and finding ways that they can help you engage in your work. So now you've got your assessment completed. Now you've shared with your community what the results are. You've started looking at what different strategies might work for your community. You need to think about your resources. What is your capacity? How much time and additional resources do you have available to do your work so that your plans are realistic and that your outcomes that you're going for are realistic based upon your capacity. Then, once you have that, you can utilize the assessment to develop your strategies for your implementation plan, focusing on the dimensions that will increase your community's readiness for the prevention of problem gambling. Now, we have, there are 6 dimensions, but our programs choose to focus on 1 or 2 of the dimensions in their implementation plan, and those will be the dimensions that they'll be looking at in the long term for their long-term outcome. But know that the efforts that you do in focusing in one dimension will impact other dimensions because they just really do build upon each other in that way. And the whole idea is really just to continue building awareness and increasing your community's readiness so you can move to the next stages of readiness and increase the different types of strategies you're doing. And so again, we didn't focus on each dimension, but they did pick key dimensions that they felt within their community. Generally, they're the lower scoring ones, but that may not always be the case. But certainly it was an important piece of picking which dimensions they really felt that they could work on and that they could actually make a difference within based upon the impacts of what was going on in their community. So now we're going to take a look at some of Oregon's results. And I want to kind of keep us moving here. I know that I get to talking too much. So one of the areas that we wanted to share with you is around leadership. So our leadership statewide average in this category was no awareness. And you can see there are some areas across the state where they might be at a little higher stage where they're in the denial and resistance. But overall, the majority of our counties or regions, so this section here, Hood River, Wallowa, and Sherman County are a region. And then we have another region, which is Gillum, Morrow, and Wheeler, that there are different regions that we have, but overall it was that no awareness was where we were at in leadership across the state. So then so with the goal for no awareness stage, the goal is to raise awareness of problem gambling. And so here are listed some of the strategies, and these come directly from the manual that are determined to be best practice for the no awareness stage. So, making those one-on-one visits with community leaders or members. And it's really the one-on-one. It's not about getting together with huge, large groups of folks. However, certainly that's something that when it can occur, should occur. but really those one-on-one relationships, getting together with even friends and potential supporters and sharing information about problem gambling are some of the strategies that are recommended. So then here are some of the types of strategies our providers developed to impact the leadership domain in their community, where it was, again, the no awareness stage. And they looked at developing materials that for one-on-one meetings and small group presentations. So they had what they needed in hand when they set up those meetings, so they could also, provide some information, but always give something to the individual prior to leaving, so they had information to refer back to. Again, sharing the results of the community readiness assessment was a big one that they did, not only with the interviewees, but also local leadership committees. So we've had presentations to Board of Commissioners, local alcohol and drug policy committees, juvenile prevention committees, etc. So they've shared the results back, and then at the same time, always with sharing the results, they provide a little education and awareness too. And then relationship building, developing those key champions from the community, like I mentioned earlier, was a big piece around the no awareness piece with leadership. So moving on to our statewide average for Dimension E, which is community knowledge about the issue. And this was one that all of our providers have focused on as one of their outcome measurements. And overall, our statewide average was denial and resistance. However, you can see, again, that there are pockets of areas across the state that scored higher. And in those areas, they would utilize strategies that were best suited for their stage. But statewide, from our office and a work that we're focusing on, we're utilizing the denial and resistance stage. And so, and even, it's always interesting when we have one outlier that it was even higher, and really looking at in that community, what have they done? And that's one of the processes we're looking right now to see, what brought their scores in higher there. And is there something that can be replicated? We don't have that information yet, but it's certainly something that we're looking at. And then, quickly again to share, this is another dimension that we have a focus on, but also came in at the denial and resistance stage, was the community knowledge of the efforts around problem gambling prevention. And we did find often in our assessment that there was awareness, again, like I mentioned earlier, around treatment resources, that treatment is here in Oregon, and that, we have treatment services in every county, and that we have a helpline and stuff. But when we boiled it right back down to their awareness level around what prevention related services are available and what are our communities aware of to prevent problem gambling from occurring, our awareness level was more in the denial and resistance stage. So the goals for denial and resistance is to raise awareness that problem gambling is an issue in the community. And you can see that many of the strategies here, they're the same as they were for no awareness, but they do build upon each other. And again, these come from the manual. They're a part of the best practices that the community readiness model shows for strategies in the stage of denial and resistance. In Oregon, our community leader level providers focused on increasing awareness with their communities by utilizing a variety of those different strategies, handouts reflecting the results of the community readiness assessment. As you can see, these again are just building upon the previous stage, and then the educational resources for prevention of problem gambling. They utilized a lot of materials for one-on-one conversations with community partners. They started emailing community partners with did you know statements. So when they were outreaching their community partners, they would add a did you know statement regarding problem gambling and invited them to reach out to learn more. And they shared the Oregon problem gambling resources. They developed and disseminated problem gambling information in a variety of different venues like newsletters, posters, postcards, there was billboards, and some social media. And then again, local presentations with problem gambling information is integrated into other topic areas or standalone. But we found that integrating into other topic areas often helps us move forward and getting our foot in the door and sprinkling our problem gambling prevention information in along the way. I see there's a question. Did Oregon focus on problem gambling behaviors in adolescents? We did not at this point in time. It is an area that we are definitely keeping an eye on and watching for, but the community readiness assessment was primarily focused the community at large. So certainly could cover adolescents, but they weren't a primary focus. So good question. Thank you. Oops, sorry, there goes the ums. So I want to just share with you some examples from Oregon's provider network. I cannot take credit for this work. These are things that our providers have created, but I think there's some pretty cool things here I wanted to share with you before our time finishes up today. So we had a provider who developed a pretty robust PowerPoint presentation where she included her results from her community readiness assessment and also included education and awareness into the PowerPoint so that it wasn't just, I'm here to talk to you about our assessment, but provided some information and awareness as well. So there was a one-page fact sheet that could be handed out, a couple different fact sheets, knowing the guidelines for responsible gambling, but also some different things about statistics in their county in relationship to the data and awareness messaging. So they were great one-page handouts that they were able to hand out to the audience and also email out afterwards as well as part of their Did You Know campaign. Also, there was this one was actually, they didn't, when they first planned it, were not aware that COVID was going to be coming, but they had already ordered these little individual hand sanitizers. So they were very popular after March of 2020. And these little hand sanitizers have a carabiner attached with a little business-sized card that has the different warning signs for problem gambling attached to them. And so they were able to hand those out in areas where they could hand out materials and make them available to their community partners and the community. This is a poster that was developed out of some of the information that was learned from the senior focus area to where this was focusing on our older adult population and utilizes different messaging to help our senior population as it relates to their awareness. So posters that were able to be disseminated. Again, here's another poster out of that campaign. And the nice thing about all the materials that our providers develop is that they share them statewide with other programs, so they can then modify, giving credit, of course, to the program that developed it, but modify and add their own information. But we always ask our programs to use the statewide helpline number and opgr.org resource, because that's our statewide website that is also has a chat feature where it's manned by manned at all times by problem gambling certified counselors who can then work with individuals. But we also have a prevention page on opgr.org that shares information with people looking for prevention related information. This was a postcard that could be either sent out, or they also they use these and put these out with Meals for Wheels. So partnered with the Meals for Wheels program, and these were included in all of the meals that were being delivered. And so they actually had a great opportunity to hit a lot of folks, because this is one of our highest populated counties. and it has a high senior population too. So it worked really well within that community. And we're able to share it statewide. And then billboards are very popular in some of our very rural communities, and very highly coveted space. And so this is a billboard out of one of our communities that was just looking at providing some additional information. And so they got that up there for their community, let folks know that gambling does carry risk, and that, you know, not only is there the resource of opgr.org, but also their agency if they're in looking for services, et cetera, or just additional help around prevention of problem gambling. Again, here is just another example of the postcard again, they made sure they had a variety of different ones so that they could hand them out, and was well received in their communities. And here are just a couple of the different handouts that were created, one on the warning signs, another one on tips on how to talk about problem gambling. That often comes up. How do I talk to someone about problem gambling? So really playing into that bystander participation piece. And yeah, so some great tools that our folks have worked hard on, and just wanted to share with you today. Looks like we have another question. Do you use peer recovery specialists on your information and or warm line? So we don't currently, on the materials that are being handed out, our prevention folks have not been utilizing peer recovery specialists yet, although they certainly have been part of their planning process in some areas. And then our warm line right now is staffed by counselors, but there are things that we are moving toward that here in the state of Oregon around the utilization of peer recovery specialists. And so it's a great opportunity here in Oregon that we're moving into, but it's not certainly something that we currently have completely implemented. So, but good question, thank you. So that's kind of it for me. I know we're at, you know, kind of wrap up time. So just want to check in with everyone. The big idea is, what is your community ready for? And hopefully you'll have your answers soon. So any other questions? Things coming?
Yep, I'm looking to see if anybody's put anything new in the chat or in the Q&A. Any questions around the community readiness? Needing ideas for yours? I think the information was terrific, and definitely very timely for us here in Virginia, with people finishing up and some starting their community readiness assessments now. So I'll be, you know, interested to see if we're at the same kind of stage as what you were finding when they first did it in your state. And you said they're getting ready to do another one in a year or so?
Actually, we've kind of bumped because many of our programs, I mean, we're very fortunate here in Oregon to have funding, but at the same time, you know, our programs are not, we don't have full-time problem gambling prevention coordinators. They wear many hats. And then with the impact of COVID, also really, prevention folks are really versatile, and they've been pulled in a lot of variety of different ways. And so their focus has not been able to be on problem gambling prevention in some of our communities. So we've set our assessment stage at 5 years from the initial, to allow for opportunity for greater impact. And so yeah, they'll be, it looks like 2024. Which is coming up. It's funny.
Years, yeah.
Will be when they'll be redoing their assessment. Now, a program could select to do it sooner, but you know, we just made it a kind of a standard that they have that length of time. And I would say too that you know, I on the last question around the peer recovery specialist, you know, our treatment specialist is closely integrated into that work. And so I can check in with him because I feel like I kind of bumbled that answer for you a little bit. So I want to make sure I check in with him, and I'll send to Anne, any additional information we have on how that's being utilized on the recovery side. Most of our work on problem gambling prevention is really looking at primary prevention, and so that awareness and education piece. So just wanted to add that. So let's see, there's another question.
Yeah, so this, the conducting of the focus group, do you have to use consent forms for all ages or younger groups only? I mean, you can look at it to try to get someone to sign the consent form, but I would, reach out to Omni just to double check. And Omni is our provider as well, here in Virginia. So they're overseeing that, but that'd be a good question just to ask them and make sure that everybody's on the same page on that piece. And an evaluation will be coming out. I did upload into the chat, if people want to download it, a copy of the presentation, which has, all those the materials towards the end, and the one pager on all the different stages.
One of the things I wanted to add to, but not seeing another question, I don't think. Yeah, it was that, so the tools that we use for the community readiness assessment, so the manual, I mean, I know you all, I think, have your own tools, et cetera, but we do have the Oregon OHA Problem Gambling Services website, which is our provider website, although it's an open website, no passwords, et cetera. So community is more than welcome to look at it. But we have the website that does have our toolkit on it for our manual. But we also have other resources, especially on our general resource page, that you guys might find of interest that are not always Oregon specific. We have a whole public health, the impacts of public health on gosh, I am struggling here. The impacts of problem gambling on public health. Thank you. Mm-hmm. It's still morning for me, sorry, but with research briefs that are really looking at research around different topic areas, and they're not often, there are occasionally some data points specific to Oregon, but most of it is looking at national and international data, because we wanted to make sure our providers had, talking points that they could use. Often when they might find themselves at a table with someone from a different field that they're trying to show that there is an importance to discuss problem gambling. Mm-hmm. So our resources are there, and we're happy to share whenever we can. So
thank you so much.
Hey, very much on time. Woo!
Yeah, very much appreciated. And again, this was recorded, and so we'll be posting this in the next few days, and I'll send out a link to where this is posted at. Thank you, everybody, for attending.
And thank you for having me.